by Chasing the Rainbows with your host, Bernice Quisenberry.
On this week's podcast episode, we are holding our Ask a Maternal Fetal Medicine Doctor segment with Dr. Serena Wu, who is a maternal fetal medicine specialist that experienced her own baby loss. And we just appreciate you being here and being willing to help us fellow survivors, Serena.
Thank you for having me. I'm excited to be here and to be able to speak with Bree and help again.
Oh, thank you. I appreciate you. The survivor that we're interviewing, and as Serena said today, that's present, and some of you may know her voice or recognize it, is from our B and Bree segment. Brianna Groover is here to ask her own questions about one of her losses of her son, Landon. Thank you.
Hey guys. Nice to be with you again.
Great, and thanks for coming. Yeah, so before we get started, just a real quick disclaimer. We are not giving out medical advice, medically treating any person, diagnosing any person, providing second opinions, virtual consults throughout our podcast. What a mouthful. This segment is to give some peace to our listeners who are struggling with some questions because of the whirlwind of events that happened during our traumatic losses. But we are opening the ability to have a dialogue without feeling judged or silenced around our losses, and that's what's really important. We are promoting awareness and actual feelings that occur during our losses for a safe space to talk about any thoughts and feelings openly and honestly. For medical advice, treatment, or diagnosis, please consult your primary physician or obstetrician. Our intention is solely to help survivors process their own loss. So we have received numerous requests from survivors through our criedoutloudpodcast.com website. And we are grateful that we're being found. So if anyone's out there listening and you have questions around your loss, please write in and we would love to host you on one of these segments. With the volume of requests, though, we do ask that everybody please just be patient as we work through them. And we can only select a couple to highlight as we work through the list. However, being assured that we will answer your questions as we're working through and on the process of each segment. So we may reach out for further questions and discussion by email or to host you on the website, to host you on the podcast, I'm sorry. So with that said, we are gonna dive into Bree's questions around her loss, like I said, and Dr. Serena Wu.
Yeah, Dr. Wu, thanks for being here and answering some of these questions. So just a little background. So a lot of you know my story just based off of our previous podcast. So I had lost, I had two stillbirths. I had one, his name is Landon, and I lost him at 16 weeks. And that's kind of where my questions come from today. So my pregnancy, when I got pregnant, we had no trouble getting pregnant. Normal pregnancy, everything looked great. No issues. And then around November, my oldest daughter contracted Fifth's disease. She was originally misdiagnosed, and then I ended up contracting it later on and was asymptomatic. I went in for a routine doctor's appointment, and they could not hear the heartbeat with the Doppler, so they sent me for an ultrasound. Went in for the ultrasound, and they discovered he did not have a heartbeat anymore. He was measuring around 16 weeks. They also told me at that time that his head looked very swollen, which they said can indicate a virus. So they tested him and it did come back positive as Fifth's disease. So my first question is, how common is it for a baby to contract this common childhood illness?
So that's a great question. And Bree, I'm so sorry that you went through this.
Thank you.
And that it got misdiagnosed, and then subsequently this ended up happening. Can I just back up?
Sure.
When you say your daughter was misdiagnosed,
Yeah.
Can you just expand on that?
Like a hay fever type, like completely misdiagnosed.
Okay.
No indication that it would have been Fifth disease or anything. So it was, we walked away thinking, oh, okay, we're good. Nothing that I could contract, and we didn't feel concerned about it.
How was it picked up then?
I think from school. I later found out it was going around the school.
Okay. And so was that when you decided that, wait, maybe this is not hay fever?
So
or did she get sicker?
No, she didn't get sicker. She got better. But it wasn't until I think it was like a week or two later, then we went for another opinion. So we found out later on, but it had been like a week or two after initial.
Okay. Yeah, so for Fifth's disease is caused by a virus called parvovirus.
Okay.
And parvovirus is actually quite ubiquitous or quite common. And like you said, it's a common childhood disease. And a virus, unfortunately, there's really nothing to treat it. No antibiotics. Antibiotics are generally for bacterial infections. So what's interesting though is that it is very common in the daycare setting. Transmission to other family members is actually lower if you were to get it from a daycare setting or
Yeah, she was
setting.
3, so she was in preschool, and
Yeah.
I was also worked in healthcare, so they were kind of surprised that I did contract it because of just my immune system working in healthcare.
Right. And you would have been exposed. You might have been exposed if they were to try to figure that out.
Yeah.
We could see if you had been previously exposed through your blood work. But that being said, if you had an acute exposure and your blood work demonstrated that, we would still need to follow you. So what's interesting about a lot of viral diseases, and I'm not going to go into all of them, I'll just focus on this, but what's interesting with, like, say, parvovirus or cytomegalovirus or CMV, that would be an acronym, or varicella, chickenpox, is that being exposed to these viruses early in pregnancy causes the most harm.
Okay.
So actually, it's been found that if you are exposed, if the mom is exposed and it contracts, that in the first 20 weeks, that the transmission to the baby would be higher.
Oh, okay.
And unfortunately, that also is the time where it could cause the most harm.
And is that because of the developmental stages occurring?
It's because of the fast-moving cells, fast-developing cells.
That makes sense.
So transmission is anywhere between 8 to 17% in the first 20 weeks, and
Wow.
after the 20 weeks and then on, it's only 2 to 6%.
Oh, wow.
So it would have been important as soon as to find out, okay, my child has been exposed to parvovirus. I might have been exposed to parvovirus. Maybe I need to talk to my OBGYN or family doctor or provider to get further testing or just get more information.
Okay. Yeah. Does that, so let's, with these viruses, and if you're in those early stages and it does cross the placenta, does it always kill the baby?
No, it does not.
Okay.
What parvovirus specifically does is it attacks the cells of the blood system, and it can make the baby very anemic, and then it can make that baby develop something what we call hydrops. And I think when you refer to Landon
Yeah.
having a swollen
Yeah.
head, I think they were referring to the fact that the scalp was probably very swollen.
Yeah. It definitely was, especially when I delivered him. You could see his head was very swollen.
Right. And so what we would do is that we would monitor you if we had known.
Okay. Yeah, that was going to be my next question is so if I would have known and she wouldn't have been misdiagnosed, what could we have done? Could we have done anything to save Landon, I guess is my question.
So I don't know about, quote, save.
Yeah.
But yes, what we would have done to monitor it is that you would have come to the office, we would have drawn your blood, seen what kind of exposures you had or had not. Then we would have monitored you. And if it definitely showed an acute exposure, we would have seen you every 1 to 2 weeks for the next 8 to 12 weeks.
Okay.
That first 8 weeks is when the baby can develop all that extra fluid. And what high drops is extra fluid in places where there shouldn't be fluid. So, and we need 2 out of those, out of 4 to 5 places of the baby that need to have that extra fluid. One of them is what we call fluid in the skin, or edema. So we do have measurements for that, but it's like extra thickening of the skin. Other places where there shouldn't be fluid, that we see fluid, would be in the lung area, in the belly area. And then softer signs that are not part of the criteria but does point us in that way is like if there's extra fluid around the baby or if the placenta is extra thick. So that's what the high drops is referring to.
Okay, that makes sense. And so, if I guess it's a virus, there's not really any way you can treat a virus. I guess I was thinking, if you treat me, would it also treat the baby?
Right. Wouldn't that be great?
Yes, it would be great for a lot of things.
Right. So unfortunately, this particular virus, there's no medication. There's no IV medications that we could give, nothing orally we could give. We can only monitor.
Okay.
If we were to see signs of that the baby's developing anemia, and we do that with, and you would have to go see, by the way, a maternal fetal medicine specialist because we are trained to do that specific ultrasound. We would look to see if the baby's becoming anemic, and what would end up happening to treat your baby because of the anemia is to give a blood transfusion in utero.
Oh, wow. Okay.
So that would be the treatment if that were to happen.
And does that typically save? No, I guess save is hard to, but does it increase the chances of the baby surviving?
Yes.
Okay.
Now that's obviously it's not without risk.
Yeah.
To do a transfusion, it's also a needle into your abdomen that goes into the uterus. It's kind of like an amniocentesis.
Okay.
But where we would be specifically aiming for is for the baby's umbilical cord, where we would it would be just like as if you had an emergency needed an emergency blood transfusion. It would be a specific type of blood that would have everything irradiated in it. It would be O negative, and they don't need much. We would have to calculate how much blood that the baby would need, but we would have to aim for that umbilical cord, stick a needle into it, and then transfuse blood.
Wow.
That being said, these are done at centers that still do this. It used to be done really much more frequently when we had RH alloimmunization or RH disease. That is where moms that were RH negative had a baby that was RH positive, and it's that similar process in terms of anemia, not with parvovirus, but in terms of anemia. The baby would have the mom's immune system go after their blood cells, and then the baby would become anemic.
Okay. So is there a time frame on when that needs to take place? So, you know what I mean? Like, I guess I always struggle with, if we would have caught it sooner, could we have saved him, or could we have done something different? So, like, are we talking a week makes a big difference, or is it several weeks? Or, I mean, I assume every baby might be different depending on the type of exposure they've had.
I mean, so thankfully, the first 20 weeks in your case, it would have been good to get to the doctor, get tested, and then be followed out. And maybe in another month, get your blood tested again. After 20 weeks, the risk of transmission drops off, and the likelihood of the baby developing high drops also drops.
Okay.
But that first 20 weeks, yes, we would have wanted to see you. We would have wanted to get your blood work and blood draw, and do we need to start following you weekly, every 1 to 2 weeks or so. 8 to 17%, that doesn't sound like a lot, but when you're that one, it's 100%.
Absolutely.
And then you feel like, okay, if I had gotten into, like in your case, the doctor sooner, and they would have drawn my blood and saw that I had an acute exposure, then maybe I would have gone a different path, and maybe I would have ended up
Yeah.
getting a blood transfusion for my baby.
I've had to work through a lot of those emotions because for a long time I struggled with, well, if we would have recognized this sooner. And then I also struggled with, well, if my daughter, because I have heard that the further along you are, the better off the baby would be if exposed. And I struggled with, well, gosh, why couldn't my daughter get sick a month later? Or, it's just those what if kind of situations. And those are hard pills to swallow when you lose your baby and
Right.
knowing that the outcome could have been different if situations were different. But
Right.
this is just how it happened. And, I appreciate those answers because I think those are questions, and we all have questions when we lose our child of,
Oh yeah.
yeah, just how things could have been different, and could I have done something different? And it's nice to have those answered.
Yeah.
So
And
I
I'm so
appreciate that.
sorry that it was not diagnosed sooner.
Yeah.
And chalked up to something that sounded very benign.
Yeah. Yeah, and I honestly, and I do have to say too that even once diagnosed, my daughter, would I have had the knowledge to, because it is such a common virus, would I have put the two together that, oh, this could potentially be harmful to my baby? Because I feel like, my daughter's fifth disease, okay, she's fine. So
Right.
you assume the baby's going to be fine. Like, I don't know in my mind if I would have even put that together.
And that's an absolute great point that you made, because I don't know how many women or people, families, would have put those two together either.
Yeah.
I think some, you don't feel like you want to be that mom, that patient.
Yes,
And-
100%.
And you don't want to call and say, hey, I think my daughter contracted this, and I don't want to sound so worried, but should I be worried?
Yeah, and at what point do you draw a line? Like there's so many viruses and things out there. I mean, is there a list that's like, this is when you call the doctor, this is when you don't call the doctor? Like the list goes on and on of viruses, and at what point should you be concerned? Is there like
Right.
a top 5 that, yes, you should definitely call your doctor about? Or, it's so hard because when you're pregnant, I feel like you're so paranoid about a lot of things, especially if you're pregnant after experiencing a loss, because you're already high anxiety. And we had a loss prior to that. We had a blighted ovum. So I was kind of on high alert to begin with.
Right.
So yeah, it just makes you wonder, at what point do you drive yourself insane with every little sniffle that you have or a child of yours has? It can be a slippery slope to go down.
Well, yeah. And from your experience when you and I, and, you shared this with me and told me your story and about, Landon and things like that. Well, when we were pregnant with our rainbow baby, Faye, I contracted COVID twice, one at 8 weeks, first time. And then the second time was in my 30th week. And I'm telling you, I was so freaked out that crossed over. Because you think about it. Now, granted, we just treated the symptoms per symptom and handled it that way, and it didn't. But it does worry you.
Yeah, because you just don't know. Like
So
you
much
just
is
never
going
would have
on.
thought fifth disease would kill my child,
Right,
and yeah, you just don't know at what point should you be concerned.
Right.
And I wish there was a top 5, though. I think if you were to tell your OB or your MFM that, okay, I've been exposed, we would still follow you.
Yeah.
So I think in terms of pregnancy, fifth disease ranks in the top 10 for sure.
Okay.
And I would just encourage, just because you don't know,
Yeah.
and how are you supposed to know?
Right.
That no matter what pops up, I would just encourage that you always talk to your doctor. And, I'm not that patient. Just it's a
Yeah.
mantra. I'm not that patient.
Yeah.
I'm just a mom.
Protecting your child.
Right.
Yeah,
Exactly.
that makes sense. I love that you said that because I'm definitely always very cautious, and I don't want to be that patient. I think because I work in healthcare, so I don't want to be like that. But you're right. You have to. Your job is to protect your child, and if it's a little sniffle, or you never know what you're dealing with, because a little sniffle can be a lot of things these days.
Oh, yes.
So
sure.
you kind of have to err on the side of caution,
Right.
and speak up.
And you are your baby's advocate.
Yeah.
So
No, I think that's a great point.
When I think having like full drawn ups, like by being honest with your doctor, by having that open communication with your doctor is so important, because then, I mean, just for peace of mind, even just to have an extra blood draw or to have something else, like it just makes you feel so much better, in my opinion. Like, or, you know, you can prepare yourself for what, you know, but for me, like just, I mean, I'd rather have that conversation than not. And
yeah. Well, yeah, and live with regret like I do. You know, just well, I do. It's one of those things that I look back and I always feel like I could have done something, but you know, it is what it is, and it's given me knowledge, you know, and moving on beyond that, with each subsequent pregnancy, I was able to speak up a little louder and be that advocate. And, you know, learn from those experiences. And really, that's kind of the goal here, sharing my story too, and asking these questions is somebody hears this and, you know, maybe their child has a sniffle and they, you know, just to speak up, and you just never know.
right.
You know.
Like we talk about, like that educate to advocate, right?
Yep.
For ourselves. Yeah.
Yep.
Yeah. Absolutely.
Exactly. Well, thank you very much for sharing your story.
Thank you, Dr.
And
Serena.
I know it must be hard to, you know, bring that up and then
Yeah.
hear that, okay, there was something I could have done
Yeah.
that might have been able to prevent. We don't know 100%
Yeah.
where, but at the same time, there are, if any mom out there hears that their child has been exposed to parvovirus, they absolutely need to go tell their OB. If their OB says, oh, don't worry about it, don't listen to that either. I would advocate, I don't know if I've been exposed in the past. I need to know if I have an acute infection.
Yeah.
Because actually parvo can be, like you said, you can be asymptomatic.
Yeah. Like I was. Yeah.
So like a lot of viruses.
Yeah, that's true. Yeah. Well, thank you,
So-
Dr. Wu. I appreciate you so much.
And thank you. Thank you for having me.
Absolutely. So any survivors out there that have any questions, like we said, surrounding your loss during the whirlwind that you wish you would have asked a doctor, you just want to, you know, ask Dr. Serena Wu about, you know, please feel free to write in, and we are here for you guys. Thank you for tuning in, and please follow or subscribe to our podcast to help us reach more survivors. And we are always with you, fertility loss, pregnancy loss, and baby loss survivors. Until next time.
Thanks for listening.